Health Trust is an operating foundation here in Silicon Valley, and really we have two purposes. One is a grant-making strategy in which we actually give grants to nonprofits in our community. Secondly, we then operate our own programs and we provide direct services to families and to people who really need them in our community. And really the vision of the Health Trust is to make Silicon Valley the healthiest region in America. A critical part of our Healthy Communities initiative is to be connected to the communities in which we serve. It's critically important for us that we actually be serving people in the community so that we know firsthand the issues that they're facing, whether that be in health insurance, access to health care, or really receiving the health education that they need and in ways that make sense to them, that communicate well to them, and that really impact their lives and so that they are able to take good actions that help their health.
The Wellness Access and Education Program is known for really two major things. One is that we provide health insurance access and enrollment assistance to uninsured families, particularly children. The other component of what we do is we provide health education and promotion to underserved communities, particularly Latinos and Vietnamese families. Our clients are often those who are most in need of health services, but due to health disparities related to their ethnicity and income levels, are confronted with health barriers limiting their access to preventive health services and treatment.
The Health Trust helped me to get health insurance for my kids. I feel very, very happy because without them, my life gets very difficult. For me, now I'm working very hard, try to buy the public insurance, but I couldn't afford it. We are like 5 people living in a small room, so I still need some help.
Many of our families are monolingual. They have less than a high school education. Their family income is below federal poverty level. As such, when they visit with us, we recognize what barriers socially, economically is challenging for them, and we help to address that through bicultural and bilingual staff. They come from the communities they serve, so they understand the neighborhoods and the people that they are serving, and that's important for our families. A unique component of our work plan is our Promotores de Salud model, which is the use of community health workers, or promotores, who are provided with introductory knowledge of health promotion and education. They then take this information back to their communities.
Yo pienso que hay muchas personas que por no tener la información necesaria pueden llegar a tener más complicaciones por su condición de salud que tienen. Entonces es muy importante que nosotros llevemos estas clases a la comunidad.
Bueno, en esta clase he aprendido muchas cosas. Bueno, a mí me ha funcionado. Yo era una de las personas que come uno a las carreras, no se fija uno lo que se está uno comiendo y en lo que nos puede afectar, ¿no? Y más que nada, pues a mí me ha ayudado aquí a cambiar mi manera de alimentarme. Me ha despertado el interés por empezar a hacer ejercicio porque yo lo he combinado ambas cosas y me ha funcionado y yo me siento mejor.
We're very excited by the opening of our new Children's Dental Center on the east side of San Jose. Years ago, we learned through a needs assessment that there were significant disparities in oral health outcomes for Latino children and other ethnic groups in Santa Clara County. This center, when in full operation, can serve over 15,000 children on a yearly basis and will serve a number of low-income families.
When the families come here and they don't have health insurance, if the child is in pain or it's an emergency, we'll see the child first and then we'll figure it out later, the insurance part, because that's very beneficial. A lot of the places the child goes in pain and they won't see him right away. We do. So we're improving the oral health of many children in the county.
I think we truly improve the quality of life of our families because many of whom have never received health services at all. So they are now healthier because they have access to care. They understand what type of care, preventive services, health education, programs and services that are available, and they understand how to use those services as well. And as such, families continue to come back to us for both health and unrelated health issues.
The Health Trust is a champion for health care. They provide a voice and also financial resources to support healthcare services for those most in need in our community. If there were no health trust here, I think the health of our community would be less. We would have sicker folks, we would have more residents who don't have access to the services that they need, and our community as a whole would not be as vibrant as it is today.
In order for any of us to be healthy, we have to have access to good health care and to good education. And our wellness access and education programs really provide that to all of our members of our community. So they can get the information, they can get the education, but then they actually get the actual resources that they need. Without those, a healthy community is not possible.